All right, I think we're live. Push 1 in the chat if you can hear me. All right, thank you for the confirmation. Welcome back to the Black Brain Trust. This is episode 827, Black Healthcare Talk. Please hit the like button as you come in, share the video if possible, and hit that notification bell so you get all the updates from the Black Brain Trust. There'll be a link in the chat for you to join if you want to join the panel. And there'll also be a document in the description beneath the video for you to follow along with and reference. Let me grab that link and then we can get started. All right, push 1 in the chat if you can see my screen. All right, let's get started with this. September is Prostate Cancer Awareness Month, and I wanted to make sure that we had focused on prostate cancer awareness for Black men. We've been talking about this for a while. This is the first time we've ever actually covered it for the month, so I wanted to actually get into this tonight. So the first item on the docket is from Merced Sunstar. Mayo Clinic Minute. What Black men need to know about prostate cancer. Originally, the Mayo Clinic had posted a blog, and I'm not sure what happened to it. It seems to have disappeared shortly after they posted it. For some reason, when I went there, it said 404, not found. So it seems to me that somebody had taken down the blog. But in any event, we do have this, and we'll cover it from here. September is Prostate Cancer Awareness Month. It's one of the leading causes of cancer death among all men. However, Black men are disproportionately hit hard by the disease. 1 in 6 Black men will develop prostate cancer in his lifetime, compared to 1 in 8 in other men. They are also more than twice as likely to die from prostate cancer. Dr. Cassandra Moore, a Mayo Clinic oncologist, explains what Black men need to know to reverse the disturbing trend. Black men harshly impacted by prostate cancer, men often don't talk about health issues that occur below the belt, but maybe they should. Quote, it is the most common cancer in men outside of skin cancer, and it's the second most common cause of cancer deaths in men, says Dr. Moore. It's unclear why Black men are harshly impacted by prostate cancer. There are likely many contributing factors such as genetics, diet, environment, access to care, and racial bias. Quote, there are studies that show that African-American men are less likely to be offered even clinical trials, says Dr. Moore. Knowing your family history is important. Black men and those with a family history of prostate, breast, colon, and ovarian cancer should consider getting screened for prostate cancer starting at age 40. The BRCA gene and BRCA1 and 2 play a role in prostate cancer, explains Dr. Moore. Maintaining a diet rich in fruits and vegetables, limiting red meats and processed foods, maintaining a healthy weight, and exercising are beneficial in reducing prostate cancer. I actually got screened at 40 myself. I think I was 39 when I got screened. So I'm actually due for another screening in the next maybe 6 months or so. So all of this is actually very relevant to me. I don't know if Dr. Phoenix or Shonda H is willing to come up and actually engage this, but I can actually relate to some of the talking points here, because I think that you don't really see Black men at the clinic all that often, whether it's just a specialized clinic or a general clinic. You don't really see Black men there. At least I don't see them there as often. I worked in the healthcare system for a couple of years, just in cybersecurity and IT generally, but I don't really see Black men really lined up outside as much as you see Black women. Black women tend to be very active in the clinics, whether they work there or they're actually patients there. I think most of the time you see Black men, they kind of leverage the emergency room as their only source of healthcare coverage, usually because they don't have insurance to cover themselves. In other places, I know in Massachusetts, everybody's pretty much covered, but for all intents and purposes, you really see Black men inside these patient waiting rooms. So I think the discussion around prostate cancer is something that Black men could actually organize under, even if you want to add a political angle to it. This is something that they can actually bang on, because they're the ones mostly impacted by this. And you can actually get some support for it, because if you bring enough awareness to it, then you can actually get people's attention, because it's such a benign thing to say that Black men have are mostly impacted or the largest demographic impacted by prostate cancer. I don't think anybody's going to tell you to go take a hike. I think people are going to kind of lean into it. Another thing that really got my attention is be offered clinical trials. I'm signed up for clinical trials throughout a few of the major healthcare networks in the state of Massachusetts. And so I get called very often for clinical trials, even if it doesn't necessarily pertain to me. They actually will reach out and say, hey, we have this sort of test that we're trying to run, for the next 7, 10, 14, maybe even 30 days at best. And, would you like to participate? I opt into a lot of these things. And so, because what is it going to hurt? What are you going to lose by doing it? It's not like they're putting some kind of drug in you. They're actually monitoring your functionality, your heart rates and things of that nature, things that are going to be most common ways of measuring healthcare output. It's easy to actually opt into some of these things. So, and you actually can get paid. You can get paid pretty handsomely if you do some of these trials. I know some people have walked away with a couple of $1,000 just for participating. And so, and they didn't have to take any drugs or anything like that. So, right. Let me go on to the next item on the docket. All right, let me know you can see my screen. All right, this is from Johnson and Johnson. As Black men, we keep things close to the hip. 5 questions for a urologist about prostate cancer. Let me zoom in on this. Most men don't regularly talk about prostate, the walnut-sized gland just below the bladder that produces seminal fluid. But considering the statistics surrounding prostate cancer, they should. It's the second most common cancer in males in the United States and one of the leading causes of cancer death among all men. And like many other types of cancer, it's a significant impact on Black communities. The numbers shine a harsh light on racial disparities. Prostate cancer makes up roughly 37% of all newly diagnosed cancer cases in Black men. Black men get prostate cancer at a younger age. The men from other groups than men from other groups, and they are more likely than to have advanced disease when they are diagnosed. Ultimately, Black men are twice as likely to die from prostate cancer than most other men. However, when prostate cancer is detected earlier, either at the localized stage before the cancer has spread outside the prostate, or a regional stage when spread is limited to nearby body structures, the odds of survival are high. Prostate cancer is the only cancer that has a 5-year survival rate of 96 to 100% when found early, says Vincent M. Bivens, MD, Facts, president of Urology Centers of Alabama. The American Cancer Society recommends that men at average risk for prostate cancer discuss screening with their healthcare provider at age 50. Men at high risk, which includes Black men in general, and any man with a first degree relative who had prostate cancer, should have the conversation at age 45. Black men with a family history of breast, ovarian, and prostate cancer should discuss screening at age 40. Unfortunately, research shows that Black men are less likely to receive prostate cancer screening than white men. While factors such as social barriers, distrust of the healthcare system, and stigma surrounding prostate cancer play a role, a general lack of awareness and understanding of the disease is also a huge issue, says Dr. Bivens. That's why, as part of its Our Race to Health Equity initiative that aims to eliminate racial health disparities, Johnson & Johnson has launched Talk That Talk. This educational campaign and movement focuses on inspiring Black men to take action, normalizing prostate health discussions, and encouraging early detection. Through the campaign's website, monologue videos, social media channels, and consumer-friendly resources, such as screening checklists, guide to talking to your doctor, and PSA tracker tool, Talk That Talk is designed to empower Black men to make prostate health and regular screening a priority. For Prostate Cancer Awareness Month, we spoke with Dr. Bivens to learn more about the importance of early detection, the reasons for prostate cancer disparities, and why removing stigma is vital to saving lives. Question: what's driving the racial disparities surrounding prostate cancer diagnosis and survival rates? The answer is studies suggest that there is probably a genetic factor that results in Black men having higher diagnosis rates than men in other backgrounds. We're still trying to understand this. But the fact that Black men are also more likely to be diagnosed with more advanced stage prostate cancer is probably due to a delay in screening. The possible reasons for this delay are multifactorial. You're looking at education. Are they aware of screening guidelines? You're looking at access. Do people have good access to doctors in these communities? Are screening processes set up so we can catch the cancer at an early stage? The social determinants of health, such as a person's financial stability and access to quality medical care, also play an important part. Early on, prostate cancer has no symptoms. So if I only had $100, do I spend $50 to go across the town to a doctor if I'm not having any symptoms? For some people, it's probably not going to happen. Question: how aware are your patients of the facts surrounding prostate cancer and race? Answer: I have a suburban, an urban, and rural population in 3 different offices. I think each one has a different level of how connected they are with their health. Some are more educated about their health and more educated about prostate cancer. I have some people who know the data just as well as I do, if not better. But I also get men who come in and don't know my name. They just know they have an appointment. They don't know what medication they're taking. They just know that they take a white or blue pill. When I try to educate them about prostate cancer, they say, "Whoa, doc, I feel okay. I feel normal." Then I have to explain that prostate cancer may not cause any signs or symptoms in the early stages. Trying to get them to do a prostate-specific antigen, PSA, blood test, a widely used screening test that can detect prostate cancer, is usually easy. But getting them to agree to a digital rectal exam, which can confirm if the prostate is enlarged, a possible sign of cancer, is very challenging, especially if they have no symptoms. Question: do you think prostate cancer has a taboo preventing people from talking about it? Answer: absolutely. As Black men, we keep things close to the hip. I've diagnosed patients with prostate cancer and they say they're not going to tell their wife or kids. One guy has been cured of prostate cancer for 7 years and he never told his wife. It's just that stigma. Also, with the history of mistreatment of African Americans in general and within the medical world, such as the Tuskegee experiment, there's distrust in the healthcare system. Some men don't want to get a PSA because they might be diagnosed with cancer and they think back to the experiences of their fathers or uncles with prostate cancer, when treatment was more likely to lead to complications like incontinence and impotence. That sort of became the brand, and even though the technology has greatly improved and complications are not as bad compared to 30 years ago. As we educate men, we explain that technology has greatly improved and treatment options have fewer risks, while highlighting that men diagnosed with prostate cancer are living a normal lifestyle. With this information, the conversation will change. Question: what about reducing the stigma associated with the digital rectal exam, which is part of the screening? Answer: we've got to take that invading stigma away. First, we have to help men understand the importance of the exam. That means explaining that 18% of people with prostate cancer have a normal PSA. And the only way you're going to find cancer in those patients is through a digital rectal exam. It's also incumbent upon the provider to help men relax and not rush through the exam. Last question: what's the best way to educate men and help end the disparities in prostate cancer rates? Answer: we need to focus on education. Let's get into the barbershops, churches, social clubs, fraternities, and community organizations. Get men involved and let's make them deputies of prostate cancer care. We must educate people to understand that preventative measures are important because they allow us to detect and address possible problems early on. Let's empower healthcare providers to get screenings going. Let's put money toward screenings and prevention. Let's meet Black men where they are and get them screened and treated appropriately. Fortunately, prostate cancer is one of the diseases that with early detection, you really can impact and potentially save lives. Yeah, I have to agree with this. I think that the biggest problem is there's a lot of misinformation that goes along with Black male spaces. We see that here often in what we call Black manosphere, barbershops and, alleyways and bars and stuff like that. You do tend to hear a lot of conspiracy theory and just a lot of misinformation that goes about just about anything, not trusting, the vaccine and, making up justifications and stuff like that. When it comes to prostate cancer awareness and examination, that can go take you down a rabbit hole when talking to certain people. And so I think Black men just get misled because they just don't have access to actual information. So, like I said, I think that this is one area that a lot of Black men can actually organize under. You would think that more Black men would understand that, things like healthcare, especially prostate cancer awareness, type 2 diabetes and all these other alien conditions that hurt Black men, and even environmental justice, right? These are things that Black men could actually organize under, but you rarely hear in these spaces about Black men organizing under it. So just another article to confirm what we've been discussing. Let me move on to the next item on the docket. Let me know you can see my screen. All right, this is from the Mayo Clinic. Consumer health, do you know these symptoms of prostate cancer? September is Prostate Cancer Awareness Month, which makes it a good time to learn about treating prostate cancer. Prostate cancer will infect 1 in 8 men, according to American Cancer Society, after skin cancer. Prostate cancer is the most common diagnosis in men in the U.S. More than 288,000 new cases of prostate cancer will be diagnosed this year, and more than 34,000 people will die of this disease. The prostate is a small walnut-shaped gland in males that produces the seminal fluid that nourishes and transports sperm. Many prostate cancers grow slowly and are confined to the prostate gland where they may not cause serious harm. However, while some of the types of prostate cancer grow slowly and may need minimal or no treatment, other types are aggressive and can spread quickly. So here are these symptoms. Prostate cancer may cause no signs or symptoms in its early stages. More advanced prostate cancer may cause signs and symptoms such as trouble urinating, decreased force in the stream of urine, blood in the urine, blood in the semen, bone pain, losing weight without trying, erectile dysfunction, Seems like there are many Black men in the space who may have erectile dysfunction. Risk factors. Factors that can increase your risk of prostate cancer include older age. Your risk of prostate cancer increases as you age. It's most common after 50, which would make sense because you want to start screening by 40. Race. Black men are at greater risk of prostate cancer than men of other races, and their prostate cancer is more likely to be aggressive or advanced. I always wonder about this because you don't really hear too much about prostate cancer in Africans on the continent, which I find interesting. And I wonder how much slavery had an impact on the genetics of Black men in this country. And so I think that a lot more research should be done on those two factors. You know, if you compare Africans on the continent, they tend to grow very old. You know, Nelson Mandela was 93. When you think about Gaddafi, you know, he was in his 70s and 80s, I think, before he died. Many African leaders grow very old. You tend to hear that a lot, and many African men tend to grow very old if they're not disrupted by political infighting and warfare and things like that. Very external factors. From a healthcare standpoint, people tend to grow very old. And so I would definitely like to see more research done on the differences between African men and Black men in America. Family history. If a blood relative, such as a parent, sibling, or child, has been diagnosed with prostate cancer, your risk may be increased. Also, if you have a family history of genes that increase the risk of breast cancer, BRCA1 or BRCA2, or a strong family history of breast cancer, your risk of prostate cancer may be higher. Obesity. Men who are obese may have a higher risk of prostate cancer compared with men considered to be to have a healthy weight, though studies have had mixed results. In men who are obese, the cancer is more likely to be aggressive and more likely to return after initial treatment. Yeah, you do see a lot of brothers in the space who are a little bit on the heavy side, and they should actually consider being screened, almost immediately, probably at the end of this broadcast. If you're concerned about your risk, you may be interested in prostate cancer prevention. While there's no proven prevention strategy, you can reduce your risk of prostate cancer by making healthy choices regarding your diet, weight, and exercise. If you've been diagnosed with prostate cancer, your treatment options will depend on several factors, such as how fast your cancer is growing, whether it has spread, your overall health, and the potential benefits or side effects of the treatment. Low-grade prostate cancer may not need treatment right away. For some, treatment may never be needed. Instead, active surveillance may be an option for cancer that isn't causing symptoms. Is expected to grow slowly and confined to a small area of the prostate. If treatment is recommended, options can include surgery to remove the prostate, radiation therapy, ablative therapies, hormone therapy, chemotherapy, immunotherapy, and targeted drug therapy. So kind of reinforcing some of the previous items we read earlier. Let me jump to one last item on the docket. Let me know you can see my screen. All right, got a confirmation. This is from the whitehouse.gov. A proclamation on National Prostate Cancer Awareness Month, 2023. This year alone, more than 208,000 Americans will be diagnosed with prostate cancer during National Prostate Cancer Awareness Month. We honor the lives ended too soon and all those we can still save by redoubling our efforts to end cancer as we know it. When someone is diagnosed with prostate cancer, every second counts, but patients are too often left advocating for basic care while drowning in a flood of medical information. Even when treatment is available, some struggle to afford it or insurance may not cover it. And stark inequities exist. Black men are more than twice as likely to die from prostate cancer in this country than other men. Our nation must do more to change that. Last year, the First Lady and I reignited the cancer moonshot, setting ambitious new goal to cut America's cancer death rate by at least half over the next 25 years, turning more cancers from death sentences into treatable diseases and improving support for patients and families. I work with Congress to establish the Advanced Research Project Agency for Health, securing $2.5 billion in bipartisan funding to develop breakthroughs in preventing, diagnosing, and treating cancer and other deadly diseases, and pioneering partnerships to get those breakthroughs out to clinics and patients. We are making life-saving cancer care more affordable for millions of Americans, expanding coverage through Medicaid and the Affordable Care Act, and helping many who had received relief during the pandemic to keep saving $800 a year on insurance premiums. The Inflation Reduction Act will soon cap total out-of-pocket prescription costs for seniors on Medicare at $2,000 a year, including for expensive cancer medicines, which could save prostate cancer patients up to $6,000. We are also working to make sure prevention, detection, and treatment procedures are available to patients of all communities and backgrounds. The National Institutes of Health is continuing expansive research into environmental and genetic factors to better understand why prostate cancer disproportionately affects Black men. In response to our cancer moonshot, the Department of Veterans Affairs expanded its National Precision Oncology program to better tailor treatments to individual veterans. And we know that screening matters. Experts recommend that men with a higher risk of cancer based on race or ethnicity, family history, or other factors discuss it with their doctors. Everyone's journey with cancer is different, but with the First Lady and I know how hard it can be on the whole family. To all those caring for loved ones with prostate cancer and all those facing it themselves, we stand with you. My administration is working around the clock on breakthroughs that can bring hope and more choices to fight against this disease. Now, therefore, Joe Biden Jr., President of the United States of America, by virtue of the authority vested in me by the Constitution and the laws of the United States, do hereby proclaim September 2023 as National Prostate Cancer Awareness Month. I encourage citizens, governments, agencies, private businesses, nonprofit organizations, and other interested groups to join in activities that will increase awareness of what Americans can do to prevent and cure prostate cancer. In witness whereof, I have hereunto set my hand this 31st day of August in the year of our Lord 2023, of the independence of the United States of America and 248th. So, speaking of Black men getting involved in making this more of a political issue, sounds like the White House has been listening to the Black Brain Trust, because we've been talking about this for quite some time. We're joined by Shonda H. Good evening.
Good evening. How are you all? Good evening to everybody in the chat. I just came up briefly, Mike, after you put out the request, just chime in. All the information presented is accurate and up to date. As a medical provider, one thing that I do see a lot, and if Doc Phoenix was here, or if there's any other clinicians or medical people listening, is that the screening is not done on a consistent basis. One, there's a lot of stigma related to prostate cancer, not only amongst Black men, but just across the board with men of different ethnicities. Additionally, there is some fear associated there. I typed it in the chat earlier. The gold standard is the PSA, which is a blood sample that we collect to see if a patient's at risk for prostate cancer. One of the other things that test also looks at is to see if a patient has a increased risk for an enlarged prostate, or what we know as BPH, benign prostate hyperplasia. A normal PSA should be less than 4, but here's where sometimes the data can get misconstrued. I've seen patients to where their PSA can be completely normal. It can be 1.2, it could be 3, and they have prostate cancer. I've also seen patients to where their PSA can be 7, and they don't have prostate cancer. So as a provider, one thing I don't like to just rely on, and I discuss this with my patients as well, is just going by one test. It's a very accurate test, it's a very reliable test, but to make sure that we're properly screening, the digital rectal exam, in addition to the PSA, is the most accurate. And I do understand the concern and fear, or concern and hesitation with that. But being that the gland is the size of a walnut, if the DRE is done and it's done right, it should be smooth and not nodular. One way we can tell a patient may have an enlarged prostate and it doesn't automatically translate to they have prostate cancer is if we do a DRE and we notice on examination that it doesn't feel smooth when we're inspecting that lower portion of their rectum. That's when we refer them to urology for further evaluation. They may need a biopsy or things along that line. So just to piggyback on that.
Yeah, thanks for following up with that, because obviously I'm not a medical professional myself and not a provider, so I don't really have that much depth in that area. But being as somebody who worked for a healthcare insurance provider, I've been looking at all this data for probably the last couple of years, but I haven't really come out and said anything as much as I probably should have. We did kind of cover this earlier in the year with Dr. Phoenix and yourself about medical coverage and things like that. I think that there needs to be a way to make it digestible for Black men to really understand the significance of this. It's not uncommon to see a lot of Black men riding around, walking around with multiple pairs of Jordans and Yeezys and whatever expensive sneaker you can call it, but won't actually get some healthcare coverage for themselves so that they can actually have some preventative care by being more proactive. And so I think the White House is doing a pretty good job. I think that, the Mayo Clinic and Johnson & Johnson, I think they're doing whatever they can. And I also think that these sort of opt-in clinical trials are actually going to be really beneficial going forward, especially for Black men who can take advantage of it.
Absolutely. One thing that I do see, and this is how I present the conversation to my patients, is one, we can't force them to do anything that they don't want to have done. I totally respect that. But prostate cancer is one of the few cancers that is very slow growing. So looking at it from not only the standpoint of being a medical provider, but also being a daughter, and also is that having older men and older relatives that I know are just engaging with different men through the community, through either work, church, whatever, social organizations. This is a slow growing cancer. So in 2023, even before COVID, it's no reason that any individual, but particularly a Black man, should have to die from prostate cancer in this day and age. I know there's a lot of criticism in regards to the healthcare system in the United States because of the structural racism that's historically been in it and that still exists. But being that this is a slow-growing cancer, it doesn't make sense to where someone could potentially lose their life because they don't want to get screened. One of the initiatives that I've seen that they've started more recently is that for individuals who don't have healthcare insurance, and this is not just limited to the greater Gulf Coast region, is some of the freestanding labs, like any lab test now, Quest, CPL, I forget another big lab. You can do an individual lab screening for a minimum fee of anywhere between $25 to about $75 for a PSA, just depending on where your location is and how much they charge. Or I've even seen some local community organizations like the 100 Black Men of Houston or other cities, some of the D9 organizations that have hosted prostate screening awareness or even hosted prostate screening testing. That's strictly appealing to those individuals who may not have access to care, may have either read about or seen the misinformation related to prostate cancer. And it's a way to kind of close that gap or that bridge to where someone may be hesitant to go encounter a healthcare system, or they had a bad experience and they don't want to engage again. But just as a provider, I hate to see, particularly a Black male, but anyone die of something that's preventable, because this is a slow growing cancer. And by the time it's diagnosed, if it hasn't been screened, it can be stage 3, stage 4. That's where your options go from. We may not be able to give you radiation. We may have to go immediately to surgery, or it could have already potentially spread to other parts of the body. So that's the importance of putting the information out there. I agree with what the administration is doing. And I just think, if we're more vocal about it, hopefully that turns the tide.
Yeah, absolutely. I know out here we have Dana-Farber Care, which is I think one of the larger cancer research institutes here, and they have a sort of bus that goes around from Black neighborhood to Black neighborhood, actually doing free screenings and things of that nature. And so I think that these are things that folks can take advantage of. I also think that, the nonprofit should be targeting a lot of Black men coming out of jail or on early release. I think that getting those folks that are in these isolated areas and doing the screening there actually makes a lot of sense, because they're not going anywhere anytime soon. So you can actually start by gathering those folks that are in those areas and building up that, that database of artifacts of what Black men have and may not have. So that's always usually a good starting point for me.
Yeah, absolutely.
All right, let me get to the last piece here. Just had to show that just for folks who didn't think that the administration doesn't do anything. They're actually pretty busy. Let me know when you can see my screen. All right. This is from zerocancer.org. Black men and prostate cancer. Black African-American men are much more likely to get and die from prostate cancer than other men. Find more information and resources for Black men. And so they're just breaking down all the numbers in regards to Black men. It says that Zero is committed to bridging the gap between racial and health disparities in prostate cancer among Black men. In order to achieve our mission to end prostate cancer, we must also zero out racial disparities in prostate cancer. After screening, if a prostate cancer is suspected as a result of screening, a biopsy or further testing may be performed. If prostate cancer is confirmed, additional tests may be done to learn more about the tumor to determine treatment options. Patient assistance, comprehensive patient support. 0360 is a free comprehensive service staffed by case managers who help patients and their families navigate insurance, find resources to help pay for treatment and living expenses, connect with emotional support services, and ensure access to care. Peer support us to support groups, zerocancer.org support groups, a variety of peer-led virtual and in-person groups are available, offering emotional support, resources, and education to empower those impacted by prostate cancer to make informed decisions on testing, treatment, and management of side effects. Groups for Black men are also available through Black Men's Prostate Cancer Initiative. Mentor, a one-to-one peer support network where trained volunteer mentors have a wealth of insights to share based on their experiences. Zero Connect, a Facebook-based support group for participants to share stories, ask questions, and connect. An invite-only Facebook group also exists for Black men caregivers. Another online peer support option is the Inspire Online Support Community, which connects patients and loved ones to enhance the quality of life for all of those affected by prostate cancer. So it looks like, yeah, this is one of the things I was seeing here. We have something like this here, similar here, one of these sort of clinical buses that go around doing something very similar. Yeah, so I just wanted to cover this last piece here. I do think it's very critical. It's in the docket and description beneath the video. If anybody is interested in, seeking further insight on this, look at the sponsors: AstraZeneca, Signify. These are pretty credible institutions when it comes to the pharmaceutical industry. Says Black men should begin talking to their doctor about screening as early as 40. I would argue you could probably do it at 35. Any thoughts on this, Shonda?
I agree with the article. I think, or with the information there, all of it is up to date. Again, this condition, unfortunately, disproportionately affects Black men, and the numbers have decreased. But we have to be more vigilant about getting brothers diagnosed if they have it, not only screened, but if they do have it, finding it at the earliest stages. And that way there's a better chance of not only intervening, but also extending their life. Because it's a treatable, it's a curable cancer. So with that, I know some of the previous treatments that they had done for years, there was a lot of concern with erectile dysfunction post-surgical intervention or even post-radiation intervention related to prostate cancer. There's still some incidents of that, but with the advancement of technology as well as the advancement of medicine, a lot of times if that procedure has to be done, it can be done robotically. Mm-hmm. So there's less scarring and there's less incidents of that. I was trying to post the article in the chat and I was able to find it. It's an older article from like 2009, but it speaks a little bit to how there was a research done. I think it was three doctors, or one of them was a researcher, in regards to the incidence of prostate cancer diagnosis with African-American men here in the United States, the Caribbean, and parts of Africa, particularly Nigeria. And I think they looked at Benin and maybe even Gambia. So I posted that if you all are able to pull it up during your leisure, or I can send you the PDF if you have trouble opening that.
Oh, it's a PDF.
Mm-hmm.
Oh, okay. Yeah, if you could post that in the back chat.
Okay.
While we wait for Shonda to come back with that item, let me stop sharing my screen so we can bring up her item.
Okay. I just posted it in there, Mike.
I don't see it. Oh, okay. I see it. All right. Let me know when you can see my screen. All right, looks like this is from Biomed Central, infectious agents in cancer, prostate cancer disparities in Black men of African descent, a comparative literature review of prostate cancer burden among Black men in the United States, Caribbean, United Kingdom, and West Africa. Interesting. Let me see if I could just go through this first paragraph. Let me just go through the introduction. In the United States, an estimated 30,870 cases of prostate cancer are expected to occur among African-American men in 2007, accounting for 37% of all cancers diagnosed in African-American men. Between 2000 and 2003, the average annual prostate cancer rate was 60% higher in African-American men compared to white men. In addition, African-American men have the highest mortality rate compared to any other racial or ethnic group in the US, and 2.4 times higher than in white men. Although prostate cancer incidence and mortality rates have been declining in both African-American and white men since 1991, possibly due to improved diagnostic techniques, better screening, and improved surgical and radiologic treatments. The rates remain comparably higher among African-American men. Why does this disparity continue to exist among African-American men in spite of the significant research to eliminate this disparity? Oh man, this is something I would have to sit down and actually read first before I even try to assess it on a live stream, but it's definitely interesting to see all the data that they're trying to collect here. This is something I'll have to come back to. But thank you for this link, Shonda. It's definitely something I should probably add to the docket and description beneath the video, because this is something that can't be refuted, you know, by some of these other folks who want to challenge it. What would it be challenging it with? I don't know. But this is something I had been wondering for a while. Why does it seem to impact Black American men more so than you see with like African men on the continent? You know, why do they tend to live significantly longer despite the economic differences, socioeconomic differences?
That, and I can't remember the source I originally heard it from, but I remember a couple of years ago, there was a discussion about prostate cancer, and it was either a fellow urologist or it may have been a general practitioner physician that was, because someone had asked the same question. And they mentioned that there was research that correlated to where there were higher incidents of men of Jamaican descent having higher incidence of prostate cancer. And that always made me want to search for this article here. I think it's multifactorial because our diet here in the US is a little bit different than, or vastly different than in the diaspora or even parts of the Caribbean. They more so live off the land than we do here. So I think that plays a role into it. But just to break the numbers down, it would be interesting to see, you know, why there's higher incidence here than other areas when we all share some of the same genes. So, and to keep in mind, this is in 2009. If I find something, or if somebody finds something that's a little bit more updated, you know, feel free to share. But this is kind of where that discussion spun from.
Definitely much appreciated. I really interested in digging in through this this weekend, in my spare time. But that's all I have on the docket. Is there anything else you want to share, Shonda, before we exit out?
No, thank you for allowing me to come up and chime in for a few minutes. But you know, I'll just keep pushing. You know, get screened. Get with the provider or healthcare provider you can trust. And if you're not able to find that, at least try to get the blood work done. And that can be done, you know, through outlets outside of the healthcare system.
And thank you for joining us, Shonda. Please hit the like button on the way out, share the video if possible, and hit that notification bell so you get all the updates from the Black Brain Trust.